clotting and liver. Okay, so you want to read your exemplar on liver and uh, make sure that you know the content for the exam. Okay. Your clotting information is everything that I would pull from the beat on your slide as far as clotting because you're using two different books. Some are using the 9th edition, some are using the 10th edition, and I think some of them don't even have a lot of the clotting information in them, but anything that would be pulled from clotting will be off your slides. Okay?
So what is your exemplar that you say, like, you said read the liver exemplar? Like what,
Cirrhosis.
what book is that?
Uh, 9 or 10.
Okay.
9 or 10.
Okay.
9 or 10. We're not pulling from the P's and the D yet. OB will be with Miss Heather, and P's will be later on in the semester when we pull from that book. Okay, so it's going to be there next Thursday. All right, so we're going to talk about the care of a patient with liver disorders. Better or worse?
Better.
Let's say we'll just leave it off. Because I made it dark and I probably shouldn't have. I apologize for that. Can you see the writing?
Mm-hmm.
Yeah. Anybody complain about writing or anything like that? We can pull that line back there if we need to. So a lot of your HESI content comes with the liver. Just so you know, to prepare for the end of your class this semester. A lot of HESI content is about the liver. So you want to make sure you get this content down. So our etiology and genetic risk factors. We have hepatitis C, right? We all did our presentations. It is the second leading cause in the United States. Okay. Hepatitis B and D are the most common causes worldwide for liver disorders. You have non-alcoholic fatty liver disease and excessive use of alcohol. Your incidence and prevalence, 1 in 10 Americans have liver disease. Quite a big number. The most common type in the U.S. is 65% will have alcohol-related cirrhosis, Berlin-X cirrhosis. Your assessment, you need to assess for exposure to alcohol and drugs, herbs, and chemicals. You need to determine if they've ever had a needle stick, and that's very prevalent in nursing. Okay. If they've had tattoos, prisons are a big place for hepatitis. Healthcare workers, firefighters, and your police force. You need to assess their sexual history. As you know, when you presented on hepatitis, a lot of it had to do with sexual partners, unprotected sex. You always inquire about family history, and you collect all previous medical history on them. Physical assessment. This is just a nice little thing. You won't see them in a coma until they are at end-stage liver disease. They will have an enlarged liver when it comes to ascites. We see a lot of people with ascites. They can be anemic. Splenomegaly. Big one, esophageal varices. Your alcoholics tend to have esophageal varices. There's signs and symptoms. They're going to have abdominal pain, of course. Changes in their skin and sclera, the jaundice, right? They can have joint pain, muscle pain, diarrhea or constipation, changes in their color of stool. We'll talk about that a little bit later on. Fever, lethargy, malaise, nausea, vomiting, and pruritus because the liver's not functioning well. They will have fluid overload due to third spacing of abdominal fluid. Okay? So they'll have a fluid shift when they gain all that fluid in their abdomen. There is potential for a hemorrhage from portal hypertension because it stretches the portal vein. The fluid backs up and stretches the portal vein. So therefore they are at potential for hemorrhage. Hepatic encephalopathy. That's due to the shunting of the portal venous blood. And people with liver disease will have increased ammonia levels. The liver's not working, so they will have increased ammonia levels. As a nurse, these are some things we need to do. We need to manage their fluid volume. Okay. We need to prevent or manage a hemorrhage. Okay. We need to prevent or manage hepatic encephalopathy. We need to look at some diet modifications with these people. We need to decrease protein. Why?
Because protein has ammonia.
You increase carbohydrates in these people and decrease salt because why do you decrease salt? Well,
All is water.
increases fluid volume. There are vaccines for hepatitis A, hepatitis B. The specific recommendations for hepatitis A that you want to remember are proper hand washing. Okay. And avoiding contaminated food and water, which is hard to do. You don't know if it's contaminated a lot of times. But shellfish are a leading cause of hepatitis. Okay. Cirrhosis. Pathophysiology of cirrhosis. It is an irreversible scarring of the liver. It cannot be reversed. Okay? It's caused by a chronic reaction or an inflammation. And eventually can cause necrosis of the liver. There are 3 common types. Post-nephrotic, that's the acute viral. Linux or alcoholic, which is what we see in the United States. And then you have biliary cirrhosis, which is caused by your gallbladder. Obstruction of the gallbladder. We all know a lot of people get their gallbladders taken out. A lot of gallbladder surgeries. patients, you're gonna see an enlarged liver. You know how to assess for liver? Okay. Laying flat, you do the Cook method. Y'all remember that from your assessment? You can feel nodules on these. The liver will be hard when you're bleeding. You'll feel little nodules on the liver of cirrhosis patients. If you can feel it because of the ascites a lot of times. You know, their belly's already so large that it's hard to feel it. You know what I mean? So it's, but if you can, you will feel nodules. They usually have dry skin. A lot of that is because of the electrolyte imbalances. It's like with renal patients when they can't get rid of toxins, their skin becomes dry, and it's the same with cirrhosis. Okay, so you'll see a lot of dry skin in these people. Your pruritus is itching because of the dry skin and the salts that come out onto the skin. You're going to see peripheral edema in these people. And of course, sinusitis. Complications. The portal hypotension that I talk about. Okay. Splenomegaly. The portal vein. The portal vein from the liver. Portal vein from the liver. Esophageal varices. Coagulation defects. We talked about clotting on Tuesday. These people will have a lot of variations in their breathing and their ability to clot. Jaundice. Where do you assess for jaundice? Skin. Different cultures, you would need to look at their palms of their hands and the soles of their feet. You need to look at ethnic cultures. Okay, dark skinned people, you may have to look at their palms of their hands more, and the soles of their feet can be yellow also. Neurological changes. These people will have neurological changes due to the increase in money that they are holding in their body. They can almost become toast. Very hard to wake up. Hepatorenal syndrome. They can have bacterial peritonitis, black. The ascites, the fluid. Can grow bacteria. With hepatic encephalopathy, they might have abnormal muscle twitching. It's called a liver flap. We call it a liver flap, just the name that we give it. Okay. They'll have lack of concentration. They'll be tired. Esophageal varices. See the portal vein in your pictures? Portal vein here, on from the liver. Esophageal varices. In alcoholics is it's one of the most critical things you can ever. They will die. Esophageal varices will kill them because they will bleed from the esophagus. Treatment. I just put that in there because that's cool to look at. In a client who has esophageal varices, the nurse should recognize the signs and symptoms of a rupture or hemorrhage. So what do you think you would see? We'll start vomiting blood, spitting out blood. Our most important role with anybody who's an alcoholic is education. Okay. You have to educate them about the disease. And you have to tell them, I mean, if you keep drinking a fifth of liquor a day, you know, I mean, it's very well possible. Education is our most important role with anybody who does excessive drinking. Our lab work for the liver. Your AST, your ALT, alkaline phosphatase, your bilirubin, your coags, your bleeding studies, your PT9R, protein and albumin, because those are synthesized in the liver, and our ammonia level. Did you look at yours yesterday? Whose lab I used?
I wrote them down on one of those papers that I turned in, but I don't remember it.
I just didn't know if they were all elevated with him.
He had some that were elevated and then some that were normal. A lot of his were like fluctuating a lot. Because it goes like, I think it's like 5, 7, 12 hours or something like that, and 5, 9, and 12, and they were all, none of them were consistent.
What about when you had when he came in?
His ammonia wasn't elevated when he came in, but he was in 3 South ICU and all that, so it was already there.
Because he just seemed confused to me.
He had his stuff locked.
I mean, he seemed, I didn't know anything about him, but he seemed extremely confused. And he was yellow, wasn't he?
Yeah.
He was yellow. I mean, his whole body.
He was just emaciated that way.
Yeah. He was. Other diagnostic tests we can do a biopsy of the liver, an EGD. Does anybody know what an EGD is?
Esophageal gastrointestinal.
Yeah. So they take the dye or the contrast and go down inside. Upper, not lower, upper.
Yeah, upper GI.
Upper GI. X-rays, MRIs, and ultrasounds. You'll see a lot of those ordered for them. All right. Again, I'm going to stress that they will have clotting factors. They will have alterations and clotting factors. They have an increased risk for bleeding. Okay. White blood count may be elevated, could be due to the ascites, the peritonitis, the fluid that's inside. Albumin may be low, but it's because of their poor nutritional status. Again, we're looking at poor nutritional status. And elevated liver enzymes, which is your ALT and your AST. A liver is very vascular. As you saw in the picture I showed you before, there's a lot of veins that come from the liver, right? So when we do a liver biopsy, they come back to you, they can hemorrhage. So you need to monitor them very closely. You would want to check their PT9R before they have the biopsy. After the biopsy, they may have a little bit of discomfort, but there should not be cramping. Okay? They should not have severe abdominal pain after a liver biopsy. And these guys are at high risk for infection after a procedure. Very, very high risk. Anybody ever observed a paracentesis?
Yeah.
Your nursing responsibilities when you do a doctor comes in and says they're going to do a paracentesis, which is to do what? What does a paracentesis do?
Fluid.
Fluid. Yeah, and they'll use those big glass jars, right? So your responsibility, if you have a patient who's going to have a paracentesis, you need to gather the equipment, okay, which is the needles that they're going to use to stick in there. You're going to gather the glass bottles. Some of them are glass, and I think most of them I've ever done are glass. I don't know if they're made any different or not anywhere else, but they're usually glass bottles because plastic can hold infection inside, and the glass is more sterile inside, and you're talking about you don't want to risk infection going inside as you're doing this, right? So most of them are glass. You always want to check their baseline vital signs. Y'all know how I You're going to measure their abdominal growth because you want to see how much is decreased after they take biopsy. You need to measure their abdominal growth. Pre-procedure, measure their abdominal growth. You're going to have them devoid. Why are you going to have them devoid?
They're going to be pushing around there on their bladder area.
Answer me, Brittany. Or Robbie. They don't make the bladder because if the bladder is full, you're talking about the abdomen, right? The bladder's here, and if they can nick the bladder. So you always make sure they void before you want to observe the fluid and color as they're taking it out. I've seen yellow. I've seen blood tinge. I've seen yellow with white strings in it. I've seen, because that's the peritonitis. I mean, it can be yellow and have white stringy stuff in it. Fibers come out of it. I mean, it's just very nasty. You're going to treat them as a surgical patient, and you're going to do vital signs every 15 minutes for the first 1 to 2 hours that you have them. Ammonia. Big thing with the liver. Okay? Big thing with the liver. It will not work properly if you have high levels of ammonia. Okay? It's a chemical made by bacteria in your intestines. Too much ammonia in your body can cause physiological problems, confusion, tiredness. Final stages, if it gets really, really high, the ammonia level gets really, really high, they'll be in a coma and they can't. Okay. Not even gonna try to say it. Hyperammonemia, whatever, is the cause of encephalopathy. And it is commonly seen in people with liver disease. Okay. Encephalopathy is a general term that means brain disease. Okay. They're going to have an altered mental state. It can be due to infection, anoxia, metabolic problems, which we're going to go into our ABGs on the 21st. We're going to talk about some metabolic issues on the 21st. Toxins, drugs, physiological changes, trauma. Those are just some of the causes of encephalopathy. They'll lose brain function when the liver is unable to remove the toxins from the blood. Okay? That's why we call it hepatic encephalopathy. It can occur suddenly, or it can take a long time to occur. Medications that we give to lower our ammonia levels, the one and only, lactose. Anybody ever given it? What does it do?
A lot.
And it smells like buttery, gross.
Yeah, they don't like to drink it. So what if somebody tells you, oh, I'm feeling better, I really don't want to take that? It's too bad. They do have the right to refuse, right? Every patient has the right to refuse. We can't force them to take anything. However, just because they are feeling better and their ammonia level is low, it is necessary for them to continue to take the lactulose to remove the ammonia from their body. Okay?
And if they get too confused, they lose their capacity.
Yeah.
And you're giving it to them anyway.
How can you give lactulose, you guys?
I've only seen it in the little, like,
The cup thing where you drink it.
You can also give it rectally. You can give it in an lactulose. So they can either swallow it, or when they become comatose and are unable to swallow, then we do give it in a lactulose. And lots of diarrhea. This is one room you would need again probably 8 hours out of your 12 hours clean. And then you have to worry about skin breakdown. Yeah. These people are very, very sick. So again, our role as a nurse, I'm stressing interventions with you. Stressing these interventions with you. Our goal is to manage fluid volume, which means intake, output, right? We want to prevent or manage a hemorrhage. Okay. And we want to prevent or manage hepatic encephalopathy. That is our role. We're going to talk a little bit about hepatic encephalopathy. It is graded on a scale of 1 to 4. As I told you. It may begin slow and worsen over time. Early symptoms, they may have a musty odor to their breath. They'll have changes in sleep patterns. They'll have different levels of consciousness, their inability to think clearly. Confusion. Always think LFC is the biggest thing with these people. Level of consciousness. Orientation. They can have personality or mood changes. Papa might be the sweetest person around when he doesn't have high money levels or anything like that. But once he gets like that, he can get mean. Okay. So I have poor concentration and judgment. Again, all levels of consciousness and orientation. That's for your big assessment. In the beginning, they can have worsening of handwriting or loss of their hand movements, small things that you may pick up on. They can have tremors, which severe symptoms include the abnormal movements or shaking of the hands or arms, which is why we call it the liver flap. Their hands can just flap. Okay. Agitated. Again, they could be the sweetest person, and they can be the meanest person. Seizures, those occur regularly with these people. Again, disorientation, orientation, LOC. I can't stress that to you all enough. Orientation, LOC. Level of consciousness or orientation. That poor little guy yesterday didn't even know what world he was in. I don't think. Behavior or personality changes. Slurred speech. Sluggish movements. And at the end, they can become unconscious in a coma and possibly death. Nursing intervention. Oh, wow. So our concept was cirrhosis. If you look at that, you have pain. They're going to be in pain. Infection. Fluid and electrolyte imbalance. And inflammation. I'm not going to read all this to you, but you can read it yourself. But it goes down through the physical assessment, your clinical manifestations, talks about your nursing safety priority. You want to monitor for ascites, esophageal varices. You want to monitor their coags again, encephalopathy, coma, hepatorenal syndrome, spontaneous bacterial peritonitis. We want to prevent infection. You want to watch for signs of a fever, complete loss of appetite. All your life values that you want to look at are listed there. Kind of gives you a little scenario. Gives you the vital signs and everything, so it's good to look at. Now we're going to go to our hepatitis. A little while. Hepatitis, this is where I was asking you questions from. Everyone covered pretty much everything that they had on their assignments. A and E go together. Okay? If it's a vowel, it comes from the vowel. oral route transmission. There's only a vaccine for A though, not E. Hepatitis B comes from body fluids, blood, semen, saliva. There is a vaccine. Hep C, transmission, blood, and semen. No vaccine. Hepatitis C, that's the super infection of HBV. Transmission is blood, and there is no vaccine. Signs and symptoms are pretty much the same throughout them all. C, they may not have any symptoms though, remember? Your baby boomers have lived with it for years, and maybe never had an outbreak. Treatment, all types, none, rest, activity is tolerated, their nutrition status, and their hydration. With hepatitis, we want to evaluate the liver function. Okay. We can order a series, if they may order a series of hepatitis tests. You want to look at their ALT, their AST again, their liver function test. Albumin is a protein. It helps move minerals and nutrients throughout the bloodstream. And if the liver's not working, your albumin levels are low. So these are all tests that can be ordered for hepatitis. Hepatitis A is highly contagious. You can get it from contaminated food, milk, water, or from contact with a person who's infected. Shellfish, again, your book specifies shellfish over and over and over. Or nothing. Mild cases don't require that you have any treatment. They'll just ride it out like the flu. You need to practice good hand hygiene. We'll go back to hand washing. And vaccines are available, remember. Signs and symptoms. I'm not going to go through all these for you guys because you pretty much presented them and we pretty much went over them on the one slide. I did include them in here though, so you can go back and refresh yourself. Okay. You're going to see fatigue and nausea, vomiting. It can display itself as the flu. They will have clay-colored stools, dark urine because the liver's not working right, joint pain, and jaundice. Those are the main things I would look at that would be your signs and symptoms. Treatment, there is no specific treatment for anything. You clear the virus itself. You shed the virus yourself. The liver usually heals within 6 months with no damage. Rest is the very first thing we put them on. You want to manage their nausea, so you would want to have some nausea medication on. Avoid alcohol and medications. What kind of medications would you want to avoid? people, and I can always stress this to you, we don't ask this enough. You also need to ask about herbal medications or supplements that they take. You know, we always say prescription medications. What medications do you take? Turmeric can cause an increase in bleeding. Turmeric concurrent, which is over the counter. So there are other supplements. And so when you have patients that have these disorders, we need to ask about those therapies. Even teas, herbal teas, can cause major side effects with some treatments. Okay? Just because we consume it as a tea doesn't mean that it isn't a medicine. Okay? So go ahead and get that in your head while you're thinking about things, because a lot of people will take supplements. I'm a big herbal supplement person. I take my turmeric, I take my elderberry, I take all of that. You know what I mean? So, I mean, when I go to the doctor, do I write it down? No, and I'm a nurse, you know? But I don't write it down. I don't think of it. But I do want to stress that to you, and I probably should do it myself. But I do it for my patients. I do ask them, you know, do you take any herbal supplements? Do you drink any teas? Things like that. But then, I guess with me, I just feel like it's unimportant, you know, whatever. But nurses are the worst, and doctors are too. But I do ask. I have learned that in my career that, you know, certain medications will interact with others, and they can just be herbal supplements that do that. So it's important to remember to ask that information. Hepatitis B. This is more serious than Hep A. It can be acute, chronic, remember. Chronic infections last longer than 6 months. Hepatitis B increases your risk for liver failure, liver cancer, and cirrhosis. Okay? And it permanently scars the liver. They can recover fully. And there is a vaccine available. And the vaccine is now given earlier and earlier than it ever was before. I mean, little kids can take it now. I remember way back when kids didn't take it, you know. But it is more and more available. Signs and symptoms, they can range from mild to severe. Again, a lot of your signs and symptoms are the same. Here we go with dark urine again, the joint pain, nausea, vomiting, the weakness and fatigue, and the jaundice. So all your signs and symptoms can be the same with each one. Okay. And little kids and peds, they may not have any symptoms at all. Causes? Pass from person to person through blood, semen, or other body fluid. You cannot get it from sneezing or coughing. Comes from sexual contact, sharing of needles, accidental needle sticks with healthcare workers. Need to be immunized for that. And from mother to child.
I have a question, just out of curiosity. How prevalent is transmission for needle stick? Is it just, I mean, normally, well, not always. I know you may not always know what your patient has, but, I mean, do you know of any statistics or anything?
I've been stuck twice. I have been stuck twice by, once by a prisoner. I was stabbed on a travel assignment, and then I was stuck in Morgantown by a young kid. I'm Hep B I mean, I have my hepatitis vaccination.
So I guess you don't have to worry about it as much if you're vaccinated,
You still have to be tested.
but you still have to,
Your incidence is very low. I mean, the prisoner who stabbed me was HIV positive. She had HIV/AIDS. So she was on Combivir, Fleetra, and Centris. So immediately I had to start his medications. So once within, I mean, like I had to have it within 2 hours the first dose. So she was at the point of dying, so she wanted to take anybody out with her that she could. And I was working in the ER in Roanoke, Virginia, and she wasn't shackled to the bed, so therefore the guard wasn't doing his duty, you know. But she did stab me, and then I took the medicine for 28 days, and I was tested for Hep B, even though I had been vaccinated during that time, and then I had to have the HIV/AIDS testing every week, and I had to have Hep C, because she was Hep C positive also. So I had to be tested for that. I went every week because those medicines can kill your kidneys, and they have to watch you very closely. Some of them are like chemotherapy medications; they can kill you. If you know, I mean, they really can. They're really strong medicines, and so I did not end up getting hepatitis C from that, and I was vaccinated against hepatitis B, and getting AIDS and HIV from a needle stick is very like 99.9% that you won't get it. But still, knowing that somebody is that viral scares you. It scares you. And then the kid in Morgantown, he was probably 18, and I stick a lot of IVs. I went to IV therapy. So every travel song I went on, they were like, "Oh, Melissa, come stick this IV. Come on, put this IV in my first time." He won't let me. Come on. So it was my last night in Morgantown. I was getting ready to go to Dallas, Texas to do my next assignment, and I'm like, "Oh, we can stick him." And I hate to say this, but, and I don't mean any offense to you guys in here, but I mean, he was a little punk that just didn't want to needle him, right? So I go to stick him, and I get him down, I'm holding his hand, I'm putting my IV in. He goes, bam, and then jerks it back, and then the needle goes into my finger. And so I went to, you go through it all, and then I went to Dallas, and I was down in Dallas on my orientation, and they called me and say, "Hey, he's HIV positive." I'm like, "Oh." You call me 10 days later and tell me he's HIV positive. I have no chance of taking any medication at this point. I have no chance of taking anything for any type of illness that he may have had. He was also Hep C positive. So, I went through a series of blood tests while I was in Dallas on my assignment, and I didn't get it. So, statistics, me speaking, being stuck twice by 2 people, I didn't get it. If that makes sense. I mean, it's very hard.
How many years have you been in that?
How many years have I been in nurse? 15? Yeah, but I've worked all around the country. You may not even experience that here. You know what I mean? I've worked. I mean, you may not even experience that here, but you may. I can't tell you that you won't. But I can say that anymore I'm not scared. If that makes sense. The chances are very, very slim that you're going to get anything from anybody, like with a needle stick.
And that was what I even several, I guess, oh my gosh, I'm aging myself. 20 years ago, we started seeing more, HIV, more prevalent cases in nursing homes, and because we actually got a lot of the elderly inmates,
Yeah,
and things like that. But and some of my nurses got stuck, and they were fine.
Yeah.
So
you just have to follow up with the treatment. I mean, the one that scared me the most was the prisoner, who, I mean, that wasn't just a needle stick. That was, that she took.
that was intentional
Well, ID access for port's what I did, and that's a bigger needle.
Right.
A port needle is very much bigger than just an IV needle, okay? So
Right.
when I de-accessed a port, I laid it down and turned around to get the 2x2. Well, when I did, I didn't know that one arm wasn't shackled, right? So when I did, she picked up that needle and stabbed me, is what she did. So it had been flushed. I had flushed it before I de-accessed it with heparin. You know what I mean? So I had already put the heparin in it, which is very slow. It's very small amount of blood if there was any blood that came through it. But still knowing, the fear of knowing that someone has something and being stuck by them is traumatic. I'll just put it that way. It is
Sure.
traumatic. It's just traumatic.
And I think doubly so when it's intentional. I mean,
Yeah, they asked me. We had a policeman there. He come. He asked me, "Do you want to call charges?" I'm like, "The woman's dying. Well, why am I going to press charges? She's dying. She's dying. She's dying. I mean, I didn't hate her for it. I'll never forget her. I don't know if she's dead now or not. I don't want to know. That's been 10 years ago. I don't want to know. It doesn't. But I'll never forget her. You know.
sorry, I didn't mean to get us off track.
Well, that's fine. I mean, the chances are very slim that you're going to get anything. I mean, I've been exposed twice to different illnesses, Hep B and HIV, and neither time have I got it. You know what I mean? So it's very, very slim that you're going to get it from anything. However, you could be that 0.01% if you don't follow up. That would be my whole advice to you as a healthcare worker. Follow up with your care because you could be that 0.01%. You know. All right. Usually Hep B infection lasts less than 6 months. It usually clears from the body if it's acute. You can cover completely from this. But then it can become chronic. Okay. If it lasts, you know the difference between acute and chronic. Acute is sudden onset, short time. Chronic is a long period of time. Usually after 6 months, they become chronic Hep B. Okay. This can last a lifetime and lead to cirrhosis and liver cancer. Okay. When little kids get Hep B, they usually become chronic. Complications: scarring of the liver, again, cirrhosis. Hepatitis, you think of it and you don't think it does anything, but it really can do a lot of damage to people. Okay. The liver cancer and liver failure. Those would be the things I would want you to remember. Hepatitis can cause a lot of more serious illnesses. So you have to think about the people who don't get their kids vaccinated. There are a lot of people who don't get their kids vaccinated. Prevention of Hep B, the vaccine. It's recommended for newborns, children, and adolescents. Us. People who live with someone who has hepatitis B. Um, anyone who has sexually transmitted infection, including HIV. In my experience with HIV people is that they usually either have Hep B or Hep C. I don't know why that is. I'd love to do research on that. But most people that I know that have HIV/AIDS do have either Hep B or Hep C. I don't know why. I don't know if it's the medicine. I don't know. I'd love to do that research someday. Men who have sex with men, people who have multiple sexual partners. have to assess sexual orientation, which sometimes is difficult to do, and you have to ask about sexual partners. We have young kids who are with different partners every week, or things like that. Okay. Illicit drug use, sharing of needles. We have a lot of that in Charleston. This needle exchange program and the homeless population. We have a lot of that here. People with chronic liver disease and end-stage kidney disease. People who travel outside the country. To perform a diagnosis, they'll usually do our blood test. They can do a liver ultrasound and a liver biopsy release. Again, liver biopsy, what are you going to do when they come back?
Monitor for bleeding.
Huh?
Monitor for bleeding.
What else you going to do? Every 15 minutes, or how long?
First 2 hours.
Okay. Treatment for Hep B. If you've been exposed to Hep B and aren't sure if you've been vaccinated, you need to check. I hope everyone's vaccinated for Hep B. You would want to get vaccinated, even if you had been exposed. You would still want to get your vaccination because it can be acute. You can get vaccinated to keep you from preventing further infections. Okay. Some of them, after exposure, and if you have acute hepatitis infection, you want to recommend rest, nutrition, plenty of fluids, and they just have to fight the infection off by itself.
I had a second round of vaccines with Hep B because when I went and took titers,
You weren't immune.
well, it also said I do take a lot of supplements, and some supplements will mask your immunity to that. So, but I said, what the heck? It's been, since I was a kid, I'll just go ahead and do it again. So.
Yeah, it doesn't hurt you. That one doesn't hurt you. Your treatment for chronic, again, they can do the interferon injections, antiviral medications, possibly a liver transplant. All right, I'm going to give you 10 minutes and then we'll do Pepsi.
Oh my goodness gravy.
Yeah.
Are most of you all in the AU10
I am.
10th edition?
I'm not. I have 9.
But the new guys, you guys should have 10, right?
Yeah.
Yes.
10. That's what I'm like.
Whitney. I sent it yesterday and actually sent all of it. I feel like when I look through the index, Mhm. Right. But what I can't remember what it's in. There's other stuff.
Have you already had your question?
Something.
I don't know how to start that video. Let me grab somebody.
End of this year. Possible. But yeah. And I'm just you know, sometimes familiarity brings confusion. When you've been somewhere for 20 years.
Yeah.
Some people, they don't like you looking at you beside. They want you to play reindeer games.
Yeah. It takes one person.
Yeah, I'm holding you personally. Right here. I'm the same.
Over,
And
you
if
know
I
where
was
like the
gonna
little
stay
food
in,
place used to be?
I need to personally.
If you go all the way to the end of this hallway, instead of making like the right, like we do to go to the
If
other
it
side,
works, I mean, I
make
got
a left right
offers
there.
from Michigan,
There's like 2 doors that you open,
I-
and then you
we had
immediately
people
go
that
into
travel.
like a
There's
little
another
lobby
guy
area, and
travels
it's
from
right there. You'll
North
see it.
Carolina to Delaware. And then we had, even when I was in this unit here, we had a guy that flew in every month from Montana.
Wow.
So, I mean, people go where they can get a slot, whatever works for them.
Yeah. Well, good luck with that.
Yeah.
I joined. I don't do anything, but I joined, so I paid my $40. So like, it just stays with this class. You support us, Kristen. But like, if you don't fail though, then like, I said if you don't fail though, then like it goes towards our pinning.
So by the end, yeah, by the beginning of next semester, by the beginning of fourth semester, Mandy will get me a list of
I thought about
everybody
that.
in here that has not put their $40 in, and then we go from there on making up the extra money that we have to have for our voting
And then
station.
if you're not a member,
Like 2,000.
Yeah.
if you're not ever a member,
Yeah. Well, that's what I'm saying, like $40 from everybody. That wouldn't be, I mean, this is a smaller class, so maybe we can even downsize and not have to pay for the building that they are doing the ceremony in. You know what I mean? Like, if this class is much smaller. They're changing theirs.
Hey
Because their
guys,
class is too big.
this is my phone number. If you guys need anything or have anything you want me to bring up at like the meetings that I have to go to, feel free to text me. Just so everyone has it.
Hi, Mr. Fred.
thank you, Anthony.
You're welcome. I have my number up there.
Got chicken out your face.
That is so cold.
I know.
I'm so cold.
You are cold, but like I feel like warm, but you feel very
Yeah.
cold to me.
I am so cold. Like I keep sticking my hands in my jacket. It's so cold. Look at Abby. Abby's like, I'll just do this. Yeah. Oh, well, there you go. That's one thing I can't stand. Like my husband sleeps with a fan on, and like,
Yeah,
and
me
the house
too.
is 68, and I'm like,
I can
So,
live.
like,
With, I can
under
live
the
with.
blanket.
I can live with your husband. It's okay.
yeah. Well, you
for
can
me.
have him. I'm giving him away for free today because I cannot stand to be cold. But like, I don't like to be hot whenever I sleep either because I don't like to wake up
Yeah, 'cause-
hot.
yeah.
Then that makes me like furiously mad if I wake up sweating. But I don't like to be like he has to turn the fan off, turn the heat up before I'll even get out of the bed. I won't even get out of the bed.
My fiance is always hot, and then his feet are always cold.
Yeah. my feet and hands are always so cold. But I'm always cold.
Make a trip to